Welcome to Health Literacy Out Loud. I'm Helen Osborne, President of Health Literacy Consulting, founder of Health Literacy Month, and author of the book Health Literacy from A to Z. I also produce and host this Health Literacy Out Loud podcast that focuses on many aspects of health communication, patient education, and health literacy. Today's guest is Dr. Linda Ciavarelli, who is a doctor of podiatric medicine and board-certified specialist in primary podiatric care. With over 20 years of clinical experience, Linda honed her expertise in preventative, orthopedic, and dermatologic podiatric medicine. In addition to her clinical background, Linda is founder of HLOL VR, an innovative startup dedicated to creating virtual reality patient education. HLOL VR aims to improve health literacy and outcomes using immersive technology. Welcome, Linda.
Hello. Hi, Helen. Thank you so much for having me on Health Literacy Out Loud.
Well, I have done hundreds of episodes, and this is the first time ever that the topic is immersive technology. Tell us all, what is that term and why now?
Immersive technology is also called XR. You might have heard about some of these technologies. Most people are familiar with virtual reality. That's one of these technologies. Virtual reality, a lot of people are familiar with gaming in this. There's some popular products out there. Meta has a VR headset that people use for this. Put a headset on and you are completely immersed in a world. So that's virtual reality.
Okay.
There's two other aspects to this immersive technology piece. So the virtual reality, you're fully immersed. Then there's augmented reality. I think the best way to explain that is, if you're thinking about buying a couch from IKEA and you hold up your phone and it shows the couch in your living room, that
is kind of eerie. Yeah.
Yes, that's augmented reality. And then there's a third term. It's mixed reality. So mixed reality is where you see the room in front of you, the actual environment, but there's a digital overlay that is interactive on top of it. I think a good way to think about it is there's a movie with Tom Cruise, The Minority Report, where he's moving things around, and that's mixed reality. So there's virtual reality, augmented reality, and mixed reality.
And what was the term you said in the beginning with an X in it?
Yeah, that's XR. So extended reality, or XR, is the umbrella that is over all of these. And that's the term, the industry term for immersive technology, where it covers all three of these aspects.
Okay. Why now? Why health literacy? Why your business? Tell us more. This is a new world to me. I'm old school and, still write in a calendar and take notes. So tell me more.
So, first of all, thank you again for being so curious about this. I kind of fell into it. One of my kids got one of these VR headsets for Christmas several years ago. And honest to goodness, I put this thing on and I had kind of an aha moment. I said, oh my gosh, why can't I use this tool to show my patients what I'm trying to tell them? For 20 years, I've been treating patients with chronic disease. I see the disastrous endpoints of what can happen with chronic disease. And I also understand the challenges that patients face in comprehension. This is a very complex system. Healthcare is very complex, but our bodies are very complex. And it's very difficult in the time-constrained practice that we have today for clinicians to not only explain what something is in a way that's understandable, but then to make it real and actionable. And so I'm always interested in finding solutions for that. And I really thought, if I could just put somebody inside of their body, like Magic School Bus meets WebMD kind of thing, then I know that I could help people better understand what's going on in their health.
Let me see if I understand. You, as a clinician, have a hard time teaching and explaining something complicated, and you're finding that your patients are having difficulty understanding what's going on, and often in a hidden part of their body when all kinds of physiology and anatomy is going askew. Put this into words for us. A podcast is auditory only. I'm going to challenge you. We don't have any of those XR tools at the moment. We have audio only. Make this real.
Like I said, it's kind of like Magic School Bus meets WebMD, right? So can I put somebody inside of their body, and not in some scary, complex, technical way, but through storytelling? It's really narrative medicine. How can I tell a story for a patient to experience in 3 dimensions something that might be very, very complex, to break that down and to make it an experiential understanding of what's happening, so that addressing the why before we address the what and the how. I think in healthcare, in a 15-minute visit, I may not have time to really explain something in depth. So if I have a tool that can help me do that by creating experiential understanding. So an example might be, we've developed content around diabetes. What we do is we sort of put somebody inside the body, and I'm doing quotation marks with my fingers. So inside of a space that represents the inside of the body in a very cartoony way. We introduce a cell. We talk about how cells need glucose for energy and how that glucose needs to get into the cell. The way that happens is insulin. Insulin acts like a key. So we actually have a key. That key is then grasped by the person by their hand. They grasp it digitally using their hand, insert it into the cell, turn the key, and allowing the glucose to go in. So that's like a very basic understanding of a very complex physiological process.
You're also introducing a metaphor in there, and you're using it visually, that key. We don't have keys in our body unless a little kid swallowed a key, but you're using that metaphor to show this. And then you talked about cartoons. So there's a visual component, a metaphorical one. And is there audio too? Or is you put on the glasses and what you see is what you see?
There's an audio overlay, and currently we create content in both English and Spanish, but we use AI voice generation, so we'll be able to create content in any language fairly easily. We do have humans checking, don't worry.
Always. I am worried. You're introducing many variables in this. You're not on firm ground with me yet. So I want you to make a case about this a little bit more.
As I should. And then, excitingly, there is an interactive part of this.
Okay.
And this is actually really important, Helen, that, we're not creating things that could be done on a 2-dimensional screen. I can show you a video of a lock and a key in a cartoony space. I can create that metaphor. I can have a voiceover. I can have sound. I can all of that.
Okay.
What you can't do in a 2-dimensional interface, like a tablet or a phone or a video or whatever, is interact. And so we actually interact with the environment. The person actually, with their hand, we use hand tracking, reaches out, grasps this digital key and put it into the digital lock. So that's a totally different experience than just seeing it on TV or tracking a mouse or something.
What if they can't get the key in the lock or don't get the concept? Then what? Does this AI voice go, try again, or, forget it, go watch the video?
We actually have a timed force forward. So if someone, they can't grasp the key, it's not working, or for whatever reason, they can't do it, at a certain period of time, the item actually happens by itself.
Oh.
That's also from an accessibility perspective. Let's say someone has limited motion that we're asking them to move. And so we wanted to make sure that these experiences were available to as broad a range of people as possible.
So you are in your office, you're seeing a patient. I don't think you're seeing patients now, but you did for many years. You're seeing a patient and you have this tool available. How much time do you spend explaining it? And does that person do it with you right there, or do they do this on their own? I'm still trying to make sense of how this fits into patient education.
That's the real question, Helen, is how do you create something that works in an actual workflow? And that was a huge part of how we developed this. So we were able to participate in an 18-month cooperative research and development agreement with the VA.
Oh, the Veterans Administration Hospital.
Correct. Who incidentally is the largest user of medical immersive technology in the world.
Oh, I had no idea.
Oh, it's amazing the work that they're doing. So we were able to do deep discovery. It was 6 sites nationwide, 6 VA sites nationwide through a specific program called the Greenhouse Initiative on, what are the clinical problems? How is it clinically difficult? How is your workflow work? So that we could develop a product eventually that really worked in workflows and solves problems. I always want to mention that the VA in no way endorses us. It's very important to say we did work together in a collaborative way, but it's not an endorsement. But what it allowed us to do, Helen, was be really thoughtful about how we integrate into clinical workflow. So to answer your question, the way that it works is first, it's completely offline. So we know that a lot of hospitals and health institutions have terrible Wi-Fi. I know this. We wanted to create something that worked totally offline, that didn't need to be, there's no login, nothing like that.
Oh, okay. That means no login or anything.
Correct. None of that. And from a practical perspective, typically at the end of a visit, if a patient had a lot of questions about a certain topic that we have a module on, I'd say, Mrs. Jones, I think that you would really benefit from learning more about this. Do you have a couple of minutes to watch a video? And I typically would call it, say, a video, and then say it's in 3 dimensions, and that was fine. If they agreed, then I would actually move on to the next patient, and my medical assistant comes into the room. And the way the system works is within 30 seconds, the patient is fully immersed. So that's how long it takes for the medical assistant to fit the VR headset on and turn it on.
So what do they put on? They put on something on their face?
Yes. The VR goggles are placed onto the patient's face and turned on. And then my medical assistant pushes 2 buttons on an iPad and the whole thing starts. The modules are about 5 minutes long.
Okay.
And, medical assistant sort of leaves the door open, keeps an eye on the person. Nobody's moving around. It's all completely seated. There's no controllers or anything complicated. People interact just using their hands naturally, putting locks and keys and things like that.
So your patients, this might be the first time they're ever experiencing something like this. I don't know if your population are traditionally gamers who are used to doing this all day long, or they might be someone like me who's used to writing an appointment in a paper calendar. Do you have new adopters who are like, what? I trust my doctor. I trust this person telling me, but what in the world is this? Do they get comfortable? Are they anxious? What's the reaction?
I love that question because that was also a big concern of mine, right? Going into this, I never wanted to create something that didn't honor the people that I'm creating it for. Really wanted to create something that was meaningful for patients, not just to make cool tech, right? That's not what I'm doing. Interestingly, and I'll tell a little anecdote that I think helps explain this a little. We have a current study ongoing at the University of Georgia in an uninsured population. But before that, we did some sort of A/B testing, not a study, where we had 2 days where we were sort of trying out some of these modules. One day was pharmacy students. So these are people in their late 20s, early 30s, maybe younger population trying these modules. And, they thought it was cool and it's interesting and I could see this working in a pharmacy, blah, blah, blah. The next day, we invited a small cohort, it was less than 10 people, of people over the age of 65. The investigators' parents, the admin, just whoever we could sort of round up in the area that was interested. Here's what's really amazing. During the student testing, things were pretty quiet. During the older adult testing, there was whooping and knee slapping and, oh
Really?
gosh, and I can't believe this is amazing. And like the wonder that was there in the older population was definitely not something that I had anticipated. And it's actually showing up in the research that's happening in Georgia now in the population 40, I think, to 80s. A significant amount of people, like a large percentage of the people, it's still early, actually, after the VR experience, broadly say, we want VR to teach us more.
Wow.
I know. It was really a surprise for me. We saw it across our refinement with the VA. It's just such an amazing thing.
Okay. You started off your story. You had your aha when one of your kids got a gift and you tried it. So you got enthusiastic from the beginning, but it sounded like it was brand new to you. Like, what is this thing? And now you've got people who use this kind of technology going, that's cool. And then other people who are newbies going, wow. So you've got a lot of enthusiasm. Enthusiasm will get us pretty far. What about the tool of teaching? Because this podcast is all about health communication and patient education and health literacy. What are you learning about this type of technology as a tool for patient education?
So I'm definitely not the first person to use immersive technology. We'll say virtual reality for now, virtual reality to teach people. There's been decades of research showing that this medium, putting people into an experience, helps people learn better. And we know that. We know that humans are meant to learn experientially. To learn
Okay.
something by just reading it is one way, but when you actually experience it, and the example I like to use is the Statue of Liberty. Most people have seen an image of the Statue of Liberty before they went to actually see her. You see the image, you recognize, yes, that's Statue of Liberty. Then you go and you're on the ferry and, you see Liberty Island. Maybe you go on the island, you see this enormous thing. You have a different experience after that.
Oh, you do. I'm picturing that right now. I'm on that ferry and with a granddaughter and like, oh my goodness. Wow. Okay.
And I think that's a great way to sort of illustrate how experiential learning really redefines how we relate to things. You go back, you see an image of the Statue of Liberty now, and you have a different relationship to that.
You do.
So that's been leveraged for decades. As we were developing what we've developed, we wanted to make sure that we were using best practices, using plain language, creating that standard, being the sort of at the forefront of VR patient education. We knew that we're sort of setting this standard and in that space. And we wanted to be very, very sure. We were able to, as part of our development, the 2019 Diabetes Educator of the Year has been a part of our team. And so
Okay.
decades of experience in patient understanding. We also have a brilliant scientist who has worked in immersive technology, in behavior change, as one of our people that helped us develop this, as well as an artist who has, again, decades of experience in using this technology. And so really pulling from all these different places to make sure that what we develop is correct, is useful, and is also approachable for everyone.
That's great. And it sounds like you're certainly bringing in those health literacy principles too. For almost everything in medicine, there's benefits and there's risks. Is there a downside to this?
So there are some people who this is not well suited for. So someone with very low vision, this is largely a visual medium. I think that might might be challenging, some with low or no vision. Also, people who have active vertigo or
Oh,
a seizure disorder, it's not recommended, right? So, and that's okay. I will say anecdotally, in the thousands of modules we've tested thus far, have had 2 people say that they didn't feel well and didn't like the experience, which I think is actually much less than I would have expected. And if you look at the literature, it probably should be closer to not 0.2%, but more like 2%. But we're very careful before anyone is assigned this to make sure that the clinicians understand the limitations for who should and shouldn't have this.
that's great. I'm thinking of when I go like to Disney and I do get motion sick going into those things. So I don't know how much I'd like this, but at least you're aware of that. What about learning? For the learning to happen, you started this because you know your patients don't understand something. In this case, you're talking about some principles of diabetes. Are they learning through this 5 minutes of this virtual reality?
Yes. So I can objectively say yes at this point. Before it was more anecdotal, but looking at the early research that's coming out of the university in an uninsured population, we see a significant increase in understanding,
Great.
not only understanding, but also intent to act. And so that's an early signal, specifically around medication adherence. We have some modules on diabetes medications, and a large percentage of the patients had moved from being somewhat motivated to take their medications to extremely motivated, which is really great. Like that's so there's a learning aspect and a motivation aspect. Again, the research is ongoing, and it's also looking back at the data on using virtual reality in patient education. You can see that there is a significant increase in understanding that's been demonstrated through other modalities.
So I'm thinking of the practical side of this too. It just sounds awesome. Everything that this is available. On the practical side, can clinicians or anyone access this? Is it expensive? If they are enthusiastic enough to at least give this a try or think it might work where they are, what then?
So, as you know, adopting new technology in healthcare is not always easy. I think it really does require the way that it's from a commercial perspective, the way that we put it together is it's a very low annual subscription fee with unlimited use. I made that something that I really wanted to focus on as we were developing this. I wanted to make sure that this would be available for FQHCs, for libraries, for, really
Okay.
anywhere that's available, without a huge price tag. So that's one. From an integration perspective, because we don't collect any PHI or touch the internet.
PHI is personal health information.
Correct,
Okay.
correct. Protected health information. So none of that is collected at this point, and so we really sit outside of any of those challenges within adopting this in a healthcare system. The most challenging part of creating, integrating a new technology is making sure that it's being integrated in a way that's not disruptive to the clinical flow. And so that I think is something that's always something that we want to be really thoughtful about, but have had success, certainly had success and are moving towards that in some of the pilots that we're running.
Thank you. Well, I'm excited about this. And I know that you said yours is not the only technologies that doing this. And it's not just, I want people to be able to try and access and learn more about this, your work, and perhaps those of others. Is there a URL or a link you might send us to just kind of to do our own learning about this?
Of course, yeah. I mean, so House Call VR, that's the name of our company.
.com.
.com, correct. I know you have to say that now, right? And it's not always .com. And the reason why we call it House Call is because we really wanted to make the patient at the center. And in a house call, the patient is
Oh,
truly
okay.
at the center of the healthcare system. And that was, again, that's a big part of how we're designing this. Of course, always happy to speak with anyone, but really am really excited to share these new technologies are being used for health literacy to bring us into the next century where we're moving beyond some of the more challenging ways that we're trying to educate patients that are, time intensive, that may not be as effective as we want, and using these technologies to make that more available to more people in a standardized way.
Linda, I'm going to be a little candid here. You approached me about this topic, and I go, another person trying to sell me something, or just wants a few minutes of podcast fame. I'm not so sure. And then you and I connected a little bit more and had a conversation, and you won me over. To the point that we are doing this podcast episode. Your commitment to health literacy, to patient education, to action, to all those principles we're trying to do. You are an entrepreneur, you're a visionary, trying to look at the new tools that are available, and I applaud you for that. I am so glad you're a guest on Health Literacy Out Loud. Thank you for all you're doing, Linda, and for initially emailing me with this great idea.
Well, Helen, thank you. Thank you for the opportunity to be on here and to share a little bit more about what we're doing. And I really appreciated our conversations. I feel like in a lot of ways, both of us have created something that is, from an entrepreneurial spirit. And it is really a deeply creative process to do something, to make something where there wasn't a thing before. And so I'm really glad that we connected.
You're right. We connected that way in all my early years with health literacy or podcasts. Look at us now. Thank you. We're a great match. I'm cheering you on. Take care, Linda.
Thank you so much.
As we just heard from Linda Ciavarelli, it's important to consider the many ways of teaching, the old school ways and the brand new wow ways. But communicating in ways people all can understand can be a challenge. For help, take a look at my book, Health Literacy from A to Z. Feel free to explore my website, healthliteracy.com, or contact me directly at helen@healthliteracy.com. New Health Literacy Out Loud podcast interviews come out the first of every month. You can get them all for free by subscribing at healthliteracyoutloud.com or wherever you get your podcasts. Please help spread the word about Health Literacy Out Loud. Together, let's tell the whole world why health literacy matters. Until next time, I'm Helen Osborne.